So we are continuing the anterior abdominal wall anatomy. In the last video we saw the layers of the anterior abdominal wall, and now I'm continuing with the same. You people must have heard about something called as arcuate line. This line, it's a junction between the umbilicus and the pubic symphysis. It's a junction between the upper 1/3 and lower 2/3. This is your arcuate line. So what is the importance of this arcuate line? The importance is above this arcuate line there is a posterior wall of rectus sheath which is present, whereas below the arcuate line it is absent. So I am going to show you diagrammatically. This is your rectus muscle, okay, and here is your external oblique, internal oblique, and your transversus abdominis. This side also external oblique, internal oblique, transversus abdominis. So how this anterior and posterior layer of the rectus sheath is formed? I have already told you it's formed by the aponeurosis of these three muscles. So the aponeurosis will come like this. This forms the anterior wall on the other side as well. This is your internal oblique and transversus abdominis. This both join and form your posterior wall, which is very distant above the arcuate line. So below this is your preperitoneal fat, and below this is the peritoneum. So I'm just going to label whatever I've told you now. External oblique, internal oblique, transversus abdominis, and this is your rectus muscle with sheath. Here is your median umbilical ligament. Here is a medial umbilical ligament. Lateral to this is your lateral umbilical ligament. These are the peritoneal raised portions in the middle, okay. Now I'm going to draw below the umbilical arcuate line how the rectus sheath is formed. So this is your rectus muscle. This is your external oblique, internal oblique, transversus abdominis. Likewise, this side also external oblique, internal oblique, transversus abdominis. So this is your sheath. I have already told you there is no separate posterior sheath. Whatever you are seeing is your anterior sheath. Below this is the preperitoneal fat and this is your peritoneum. So I told you about these ligaments. Now let me just tell you what it is. Median umbilical ligament. So what is it? Median umbilical ligament. It is a remnant of your urachus. And next is your medial umbilical ligament. It's a remnant of a artery. That is your umbilical artery. How to remember this medial? So just remember, see, L is there and UL is there, A is there. So this you can remember by AMUL. So AMUL is for artery, medial umbilical ligament, L. Okay. Now lateral umbilical ligament. Lateral umbilical ligament is patent and it has inferior epigastric artery. These are the important structures when you are cutting through. So in the next video I will talk about inguinal canal, nerve supply, arterial supply of the anterior abdominal wall and all. Okay.